October 21st, 1854. Turkey. The British government sends a team of volunteer nurses to care for wounded warriors during the Crimean War. They discover more than severe injuries. They encounter overworked medical staff, neglected hygiene, and overall indifference to the patients. The nurses are shocked at the treatment of these soldiers. Their leader becomes determined to improve the situation and goes on to change nursing forever. Her name is Florence Nightingale. Florence Nightingale was born to a wealthy British family in 1820. From an early age, she learned many languages, excelled in mathematics, and engaged in political debates with her father. She was religious, and at age 16 said she experienced a calling from God to become a nurse and reduce human suffering. Florence's family tried to dissuade her, saying it was inappropriate work for a woman of her status. But she persevered. She learned advanced nursing skills and traveled widely. She soon realized her skills would be most useful training other nurses. In the fall of 1854, Florence and a staff of 38 nurses arrived at a hospital in the Ottoman Empire in the middle of the bloody Crimean War. She and her staff found the conditions at the hospital filthy. Florence reached out to the London Times, who gave her money to buy medical equipment. She instituted basic hygiene, like hand washing and bathing, to reduce infections. Florence's tireless work ultimately reduced the mortality rate and improved morale, and gained her the respect of both soldiers and the medical establishment. When she and her team returned to England, Florence became world famous as the Lady of the Lamp for her late hours caring for patients. In 1860, she established the Nightingale School of Nursing, which made nursing a respectable work choice for women. She also wrote a book on how to attend to the sick, met with Queen Victoria to reform the health conditions in the British military, and trained nurses to care for those who lived in squalor. She was also one of the first people to have her voice recorded for posterity.
I hope my voice may perpetuate the great work of my dad.
Florence's methods spread far and wide. In a time when women couldn't even vote, Florence Nightingale flourished as an advocate for change and a champion for the sick. She died in 1910, but her legacy as the founder of modern nursing continues today. The Nightingale Pledge, created in 1893, is still the standard pledge that all nurses take at their graduation.